Victims, professionals, we have to deal with the secondary trauma, which is connected with the problem itself. So the high prevalence, which is around the 20% of the population, is connected in 20 countries, which has a very important service, and all the countries, because it started in the United States, but of course it's not a problem in one state, it's a problem in the whole world. As I told you, in all the cultural and economical levels is working this problem. So it's maintaining, because it's a secret, children can talk, they can say anything, and it's maintaining also because of the lack of resources to deal with this problem. Another bad news is mostly of them are happening in the family. So if the kids live in the family, it's more difficult to talk and to ask for help, right? It was recognized by the World Health Organization and the scientific community, so 30 years ago it means nothing. And in 2018 it was a very important movement which started in the United States, the Times Up movement, which spread around the world and means people in general don't want to maintain this problem. Not to women, not to children. We don't want more abuse. So we want to stop now and spread. So maybe we are now in a different time, or we are starting now in a different time, which is a very good thing, because we have a lot to do. We have to move together. The European Council in 2012 started a very big campaign, which means 1 in 5. So 1 in 5 children has been abused before turn 18 years old. 1 in 5 means 20% of the population. So this campaign from the European Council is not so popular as it deserves to be. So something is happening which the problem is here, we are recognizing the problem, children are suffering a lot, but we are not doing all the things we have to do to resolve the problem. Less than 10% of the cases are notified during the childhood, according to the World Health Organization. So the secretaries is one reason, occurring in the family is one reason, and what we know is the severe consequences it has for the children, right? The post-traumatic stress disorder, the severe depression, the dissociative identity disorder, and of course the suicide. I saw in this Congress, we have many conferences talking about suicide, and it's a good thing to pay attention to what happened in the childhood when the trauma starts, because many patients tell us, look, the pain is terrible, I can't afford this pain, I prefer to die. So we have to start preventing, and we have to start stopping during the childhood trauma, right? And overall, look, from our clients, 70% is the father who was abusing. And according with other clients, the abuse starts between they turn 5 years old. So between 0 and 5 years old start the 50% of the cases of abuse, which is normal. We can understand that because for the abuser, it's easier to keep the secret with a very, very young child, which is older, sometimes could be more difficult, right? Okay, in the not very positive news, we have the judicial system, at least in Spain. It's very slow, the progress. We are doing, but it's not very quick. We are not resolving the problem. So our proposal is all the cases where we go to court need immediately protection, or need immediately therapy, or need to be seen because by the social services or the system, right? In order to prevent the isolation and the re-victimization. Okay? And also, it's very important, our proposal as well, no limitation the age of the victims to go to the court. Sometimes it's after 35, 40 years old when the adult says, oh, look, I have to go to the court, I can't keep this, and go to the court and say, oh no, too late, you can't do. So it's like the crimes war, the war crimes, never prescribed, right? And sometimes, now it is working better in Spain, only with one interview for all the services, but many times the victim, the girl, has to go to tell the social worker, the doctor, the police, the judge, and tell me what happened, tell me what happened, tell me what happened. Look, it's another victimization, isn't it? So we have to be very clear to protect children and to avoid all this kind of re-victimization after a very big problem as we are talking about, right? The sexual abuse. Okay, in the good news, what we have, the techniques, right? The cognitive behavioral therapy, focus on trauma, and the eyes movement, the sensitization and reprocessing, EMDR, are, according with the World Health Organization, very interesting tools to resolve the trauma. The trauma keeps in the brain, right? If we have a very strong experience, we are in shock, we have stress, we can react, we are in panic. So when this is keeping on the brain, the first thing we have to do is to help the patient to clean, right? To put out the experience, helping to deal with all the consequences, all the symptoms we have. But sometimes it's very difficult because the patient feels like resistance, very resistant to go into the trauma, right? For the reason these techniques are very helpful. Doing better, the relax in the brain, helping to talk about the trauma, because which is very important to talk about the trauma, because the trauma has to go out, no keep inside. Sometimes victim says, no, I don't want to move, I prefer to keep in, but it doesn't work, because the stress is on the brain, right? And the worst enemy of the brain is the stress. If we have stress, we can't have the cognitive function, we can't control, we have the anxiety and the emotional liability. So it's very important to give the brain out of stress. Do you agree with me? Okay. So the MDR, for instance, or also the cognitive therapy, works in the past, cleaning the trauma, in the present, giving the person all the tools to organize with independence his or her life, and also organizing the future, right? How can I design my future free of stress, free of trauma, right? It doesn't work, as I told you, to keep the trauma inside and forget, because it doesn't work. It's always moving the brain, right? So it's very important also to provide resources, all kind of resources, very good skill, to prove we are not victims, we are survivors, and we can do the best because we have the skills. And this is my training, right? This is what therapy helps to do. which is very nice. Biofeedback and neurofeedback is an excellent resources which help us to work with trauma. What means? If we have the stress, the trauma on the brain, and we learn to make a gym brain, a brain gym, relaxing, 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 my brain is ready, more open to start with therapy, working with the memories or the flashbacks or the panic or the fears we have. So this brain gym is excellent tool to help for the therapy, as I told you. Basically, it's like this. So we have a video game. The video game is connected with the sensor and with the monitor, right? We decide together with waves of the brain we want to train. A very high or very slow or in the middle between the sensor motor waves, right? With this brain gym, the body or the adult is watching how the brain is working, because it is working in the right way we want to train. The video game is moving, the car is moving, so you have scores, you are reinforcing the gene, right? But if you are not moving in the right way, theta, gamma, delta, the car is stuck. So it's easy, it's simple, but it's excellent tools to prepare the brain for the therapy itself, right? And after the people feel more and more relaxed, because it's a gym, we are relaxed. It's like a mindfulness, luxury way, can say. So this is the circle of fear. What does the neuroscience now show us what we already knew? So if we are in panic, if we have fear, the prefrontal cortex of the brain is loud. So we can think, we can control in the same way. The amygdala or the hippocampus is still because of the fear or the panic. So when we see that, help us also to the patient to see, to explain what is happening, because sometimes the patient feel like, oh my God, I can't feel, I am terrible, I am the worst, look, you have trauma, and this is something what happens when we have trauma. It's not your fault, right? Which is very important as well. So, prepare the brain in a mature way to start with the techniques as EMDR or CBT, right? This is a brain, the left hand brain is a 6 weeks baby. It's a normal brain. In the right side, we have a 6 weeks baby with fetal alcohol syndrome. So, the size of the brain is different, it's very small, and also the connection is different, no connection. Look, the prefrontal cortex in the upside, it didn't develop. So, the first question is never alcohol during the pregnancy. Never. The second question is how can the school require the same task to this brain or to this brain? It's not fair. A child with fetal alcohol syndrome, you don't see the difference between them, some signs, but the school can't require the same task because they can do the same. Do you agree with me? Of course. This is a 3-year-old child. This is a normal brain, and this with extreme neglect. Of course, extreme neglect is another kind of maltreatment. Of course. How is possible the brain didn't develop in the same size with the same skills? Because it was neglect. So it was press, right? By the stress. So we work also with the biofeedback, not only with neurofeedback, which means the breathing, cardiac variability, temperature, all together makes the body and the brain more relaxed, ready, right, to work on all the tasks we have to do. Okay, EEG, this is a 47 years old female with depressive syndrome, right? And in the left hand, you have the EEG before start therapy. Can you see the red color, which means the waves very slow, the anhedonia, the depression waves? And look at the right side, after the treatment, the therapy and the neurofeedback. So the red color has disappeared, and she felt recovered because of the therapy and because of the neurofeedback. Okay, I want to share with you two cases which show the techniques and also the difference in the treatment. This is the 8 and 10 years old, two brothers, which were abused by the father. And the mother had a very excellent attachment with them. Attachment is like the glue. If you have attachment, if you have a healthy attachment, you can deal with all the traumas. But if you don't have the attachment, it's quite difficult. It's very, very, very difficult. So the mother came because the brother, back at home every weekend after the visit with the father, very aggressive, extremely aggressive, and aggressive between them and also with the mother, with torture. They put stick on the nails. They were like, the mother said, like hypnosis, because the father is doctor, and she thought maybe give drugs to them, because they were like, the eyes, the look, it was like lost, right? Nightmares, screams, in panic, so the mother asked for help. So we started the evaluation, the interview, and the first diagnosis was the post-traumatic stress disorder. So he told me, look, I can't sleep at night. And this is the drawing he did, how the night was for him. Look, the ghost, the fire, the zombie, so in panic, right? They had all the post-traumatic stress disorder symptoms, very, very, very traumatic. And the worst thing was, it was very difficult for them to talk about what was happening, because the father told them, look, if you say something, I'm going to kill your mother. If you say something, you will die. I can hurt with the words, so be careful if you say something. So they were in panic. They felt with a lot of complicity, looking at each other when we were talking and asking what happened. And step by step, in a very progressive way, they started telling us what was happening, right? But it was very, very difficult for them, the recognition. Also they felt guilty. And this is another drawing for the 10 years. Well, it was here, but very clever in the school, very artistic, very, very motivated for the therapy. And also because of the attachment, the healthy attachment with the mother was helping her. So the mother and the stepfather, very positive. The therapy and the motivation they had, it was a fantastic combination to recover the boys, right? But look, it was with 8 and 10 years old when the old boy was 4 years old. At the school, the teacher wrote, he's insecure, he's isolated, he has fear, he doesn't permit to touch him. So he was asking for help. Of course, didn't speak because of the panic, but he was asking for help with the behavioral and emotional symptoms, right? But nobody did anything. If you do something at this moment, you can avoid what is many times happening. Children feel, no way, nobody is protecting me. Look, this is the drawing for another boy in our therapy. If you see at the sun, what do you feel? Which is the feeling you have? Aggressive, right? What's wrong? Panic. So, Moncho Armendariz, which is a very famous filmmaker in Spain, came to our clinic for almost 2 years or the design of a very good movie, which is Don't Be Afraid. So, I will recommend you this movie. So, in this scene, he took this drawing, and in this scene, very short scene, I want to show you how the girl felt when she was every day abused by her father and nobody else. And you put the scene, so it's the same drawing.
Pues ahora le pones tu nombre y esperas a que hagan tus compañeros, ¿vale?
Sylvia had the feeling that nobody will pay attention how I'm suffering, because the mother, of course, didn't answer. So when we go work on prevention, we ask the children, if something happened, something difficult happened in your life, which person will you tell? And more than 80% of the children respond, my teacher. But if the teacher is not, has not the glasses on to detect the symptoms, children feel isolated, devastated, because nobody can help them, which is a big deal. So we have the responsibility all together to move, to go out from this tough problem, right? Okay. They were in panic, anger, aggressive, insomnia, vomiting, a lot of the sequels, symptoms. We work in therapy with a very, very well-motivated direction, recognition, because this is the first step, recognize what is happening, relaxing techniques, cognitive, emotional, sexuality, because the sexuality also, association masturbatory, where the stepfather were helping me a lot, prevention programs, family therapy with the mother and the stepfather, group therapy with other children, so very, very well organized. But in the judicial system, what we found, of course, our report says protection for the children, no visit with the father, and is very clever, the symptoms they have. What the forensic report says, no, we don't see anything. We don't see emotional reaction. Can you imagine when all the symptoms I show you, they don't see emotional reaction in the kids? And the credibility of the testimony, they said, is indeterminate. We can say something happened. Maybe it's because they don't have many days or many time with the children. And of course, in therapy we have this time, but it was clear, very clever that they were suffering a lot. So also it was impossible to test the penetration, the violation rate, because the children were in panic. So they recognize touching, but didn't recognize more, right? So they work very well, they recover the social skills, affective skills, so they were working very well. And 4 years later, when Juan, the old brother, was 14 years old, the mother came in panic. Look, something happened. Again, it started with sleep disorders, vomiting, tantrums, sadness, uncontrolled crying. Looking for the driver, it was the father was out of the jail, and the father was looking for him because he wanted his signature saying nothing happened. So it was a lie. And also because the brother started abusing his brother. So the young brother was abused because of the stimulation in the sexual area during a lot of years, right? So, but in the questionnaire he said, I am really troubled about the memories and perversion that I could repeat and the need of a decent life. Can you imagine, with 14 years, he really wants to resolve the problem. He answered, I know it's possible. With my effort and support from others, my mother, my stepfather, my therapist, I can make a decent life free of pain and perversion. I will. So, this is another drawing by him, and the father wrote a letter saying, look, I love you very, very much. You are the person in life which I really adore. Do you remember when you were a kid and we were playing in the garden with the toys, with the drains, and this is fantastic. Please, the only thing I need is your signature saying, I didn't do anything wrong to you. Please, do it. So, he was in panic, vomiting everything. So, I want to go very quick to show you a short scene from a video, No More, from a Minoist association which is working in the same way as we work, working with boys which are abusing other boys. And look, our point of view is we want to help these boys because something happened before which explains, right, the trauma and this behavior. And we are not talking about guilty, we talk about responsibility, and we work as a team all together to resolve the problem, right?
El primer día que nos vimos ya has visto lo que hago y que te podría ayudar. Te agradezco que confiaras en mí, que me contases que de pequeño sufriste abusos sexuales por parte de tu padre. Sé que es terrible que la persona que debería protegerte y cuidarte, que tú quieres y también te quiera mal, haciéndote sufrir y abusando sexualmente de ti. Ese daño es un daño que siempre estará ahí, pero juntos podremos superarlo para tener una vida como cualquier otro chico de tu edad. De hecho, 1 de cada 5 niños sufre o sufrieron abusos sexuales.
Que yo no le hago nada a nadie, menos un niño. Eso es mentira.
Lo más común es negarlo por la vergüenza de que se sepa o el miedo a lo que puedan pensar de ti. Lo principal, lo más importante, el primer paso es reconocerlo para poder mejorar. De nada sirven las justificaciones o las explicaciones. De hecho, muchos de los agresores acostumbran a justificarse con cosas de este tipo. Tener sexo con un niño es bueno para enseñar educación sexual. A los niños les gustan las relaciones sexuales. Si el niño acepta o se resiste, yo estoy libre de responsabilidades. Esto sucedía cuando tenía problemas, no sabía lo que hacía. A mí me lo hicieron, pues ahora yo también puedo hacerlo. ¿Te suena? ¿Hay algunos pensamientos como estos o otros parecidos?
No es justo. Él siempre abusó de mí y nunca lo pillaron.
Ahí no lo pillaron, pero estamos a tiempo. Querrías ser como él. Llegar al mundo siendo así. Está en tus manos cambiarlo, depende de ti.
Ya, pero si yo lo hice es porque me hicieron.
No siempre. Hay muchas víctimas, la mayoría no lo hacen.
¿Y si fuera una chica?
¿Y por qué no? ¿Sabes que hay chicas que pasan de ser víctimas a agresoras?
Igual sí tengo un problema, pero ¿tú crees que soy un monstruo? ¿Que estoy loco?
No, lo que creo es que has sufrido mucho y que eres un valiente por estar aquí diciendo todo esto. ¿Tú crees que un loco o un monstruo daría este paso? Lo que estás haciendo ahora mismo es muy, muy importante. Si no lo hicieras, seguirías con esos pensamientos, infligiéndole daño a otros niños. Y además, seguirías destrozándole la vida como te la destrozaron a ti. Hoy he conocido a la adolescente.
The psychologist has married my book. I want to tell you, it's my book about the therapy with the abuser. And this is the way in that we work. And I want to show you how this boy worked with a group therapy with a boy who didn't want to recognize he was abusing his brother. So he wrote him in order to help. Look, this is what you have to do. And he said, me and my brother went to therapy, and in the end, we said, I hid my abuse to my brother. He was terrified, while allowing me to continue loving my father. I kept seeing my father secretly, while I believed everything my father told me was true. The problem became bigger. There was a time when I could not eat, I vomited everything, or go to school. I was terrified, play with my brother, go to the street. I had nightmares. I talk in dreams. I have remembered things that my father did to me, and I'm trying to feel with my victim, my brother felt. And I think how he will be now. That's how I realized that is the same as what I felt when my father abused me. Sometimes I feel the need to love my father, even though he has raped me, especially when I have to take responsibility for something, studying, homeworks. Then I want to do what I want, and I have fantasies of attacking my mother, and I feel that my mother has ruined my life, as my father used to tell me. This is the most serious problem I have now, and that if I don't know resolve, it will prevent me from feeling good. The problem like that has no solution, because then you do not recognize the abuses that your father has done to you, and those that you have done. I have improved because for months I have no sexual contact or I see my father, and because almost every day I tell my problems, my fears, my sexual fantasies and aggression, and I'm very hard. And this is a short video as well from Samaniego. I like the video of working in prevention with teenagers, adolescents, especially with the group, but I want to show you the scene different because the mother in this scene has no attachment, no disorganized attachment, so you can see the difference, and because the psychologist, when we work not guilty, talking about the responsibility, we are a team, we work together, and here, and of course, when we have the family therapy, we pay attention. The result has to be positive, for sure. In this scene, well, you will see how is the difference.
Ahora tus padres quieren decirte algo. Quieren coger a su hija de la mano, mirarla a los ojos y decirle de corazón cuánto sienten no haberla protegido como deberían haber hecho.
Perdona, yo no sabía lo que estaba pasando.
Ya lo sé que no lo sabía.
Ah, entonces ¿cómo puedo ser culpada por algo que no sabía?
No lo culpo. La culpa es solo de su hijo. Solo le pido que asuma la responsabilidad de los errores que ha cometido como madre.
Yo ya sabía que todo esto acabaría siendo culpa mía.
¿No es eso lo que estoy
Sí,
diciendo?
sí, es eso lo que está diciendo. Me está llamando mala madre.
Pues entonces lo lamento porque no me he explicado bien. Lo siento. Pero ¿no cree que es justo reconocer que no hubo una comunicación suficientemente buena con su hija como para que os contara lo que estaba pasando?
A ver, se puede ser la madre más protectora del mundo, ¿eh? Que te das un momento la vuelta a la niña, pues no sé, mete los dedos en el enchufe y claro, que tienes la la culpa? Pues de la madre, ¿no?
Por favor, que esto no es meter los dedos en el enchufe, que dejaste que se encerrara con ellas en el cuarto.
Es que yo no recuerdo que eso pasara. De haberlo sabido no lo hubiera permitido.
A ver, es que no vieron los indicios.
So can you imagine